Heat syncope is the temporary loss of consciousness that can occur when a person is exposed to high environmental temperatures. The patient will most likely have a core temperature of less than 104. Patients with heat syncope will typically improve after lying down with their feet elevated, allowing the blood to get back to the brain. Heat exhaustion leads to the inability to continue exercise due to the following symptoms and an elevated core body temperature of less than or equal to 104. They may also have minor cognitive changes. Heat stroke is an elevated core body temperature greater than 104 associated with signs of organ system failure, and this condition is a medical emergency and extremely life-threatening. It can be fatal unless immediately recognized and properly treated. In this demonstration, our patient had been diagnosed with heat syncope and she was being monitored. We had taken her to a cool shaded area, elevated her legs, and there was no sign of improvement after 15 minutes. So here you can see us lowering her legs, placing her into the recovery position, where you flex their hip, you flex their knee, and essentially you're helping them keep their airway open in case they go unconscious. In the case where we suspect heat illness, we do need to take a rectal temperature. So here you can see I will demonstrate how to do that. You take the monitor out, you take the probe out. We have pre-measured the probe 4 inches because that is how far you will insert into the patient. You will make sure that they're in the recovery position, so on their side with their hip and knee flexed. You need to properly drape. Then you will pull down their shorts. You will insert the probe 4 inches into their rectum after you've properly cleaned and lubricated, and there will be gloves worn during this procedure. Next, you will tape it to the patient if you have a rectal thermistor so that you can constantly monitor their core temperature, and you will lay them back down so that you can read it. For the management and treatment of exertional heat illness for heat syncope, you need to make sure to move them to a cool shaded area, elevate their legs while they lie down, take their rectal temperature, and monitor them for about 15 to 20 minutes. If there's no improvement, you need to try and cool their body and put them into a recovery position. For heat exhaustion, again, move to a cool shaded area, remove any excess clothing, and start to cool with ice towels. Now for exertional heat stroke, you're going to immediately cool with cold water immersion, which I will now demonstrate using the taco method. With cold water immersion being the gold standard for treatment of exertional heat illness, we're using the taco method here. You need to be sure to remove any excess clothing and shoes, place a towel underneath the patient's shoulders so that you can properly lift them up to keep their airway clear. And now you will have helpers lift up the corners of the tarp and oscillate. Now you will have somebody pour in ice water to properly cool your patient.